All right, we're here in our deep dive segment, and here to help me out is my good buddy, Tom Lee. What we're going to talk about today is Amazon getting into the healthcare space. And the reason I invited Tom on is because this is a guy who has built and scaled healthcare businesses. He's also the smartest guy I know, and definitely the best educated. Stanford grad, PhD from Cal Berkeley, and for fun, he got an MBA from Kellogg. So, Tom, amigo, welcome to the show.
Great to be here, Dan. Nice to
So
see your smiling face.
good to see you, my man. Oh, he's also a huge Bulls fan, but we won't talk about the Bulls today. Don't worry.
All right,
I
let's
didn't
not
want
go
to
there.
stick that dagger in you.
Yeah.
Hey, so Amazon, the 800-pound gorilla, they get into all kinds of verticals, and now they're getting into the healthcare space. They announced that through Prime, you can get sort of primary care at a discount. Walk me through sort of why they're doing this, the impact it'll have on the industry, and tell us a little bit more about it.
Yeah, absolutely. Well, the why is healthcare by far is the largest industry in the country. 1.5, $1.6 trillion. Clearly, it is a big driver of both costs for business owners
Mhm.
in terms of healthcare, and also obviously consumers. If you look at what Amazon has done over the last 10 years in sort of growing its healthcare presence, it's been quite aggressive. And it's even has a broader definition, I believe, of what healthcare really is. For example, the acquisition of Whole Foods,
Mhm.
integrating that. If you think about what is health and healthcare, and I know you're a fit guy, Dan. I mean, look at you, man.
I try.
A lot of it is about what you eat, is
Sure.
determines how healthy you are, right?
Right.
So ultimately, even folding Whole Foods into now its acquisition last year
Mhm.
of One Medical, which is now the Prime offering that you're referring to. Um, is big in terms of ultimately integrating things, just like they have done obviously for e-commerce. In terms of what it means, I like to think about it from two different perspectives. One is as a business owner myself, who also is responsible for healthcare
Mhm.
costs and things like that. Um, it's very enticing to think about that for $9 per month, I could potentially have a big chunk of my healthcare costs offloaded, particularly if I'm a larger employer that is a so-called self-insured employer. What
Right.
that means in simple terms is that the employer itself actually pays for all the healthcare costs, and you just have it like an administrative company like Blue Cross Blue Shield. It
Right.
just layers it on top, so that every dollar that's saved in primary care, for example, that could be offloaded onto the Amazon Prime One Medical offering, is
Mhm.
less money out of my organization's coffers. Um, the other perspective is from the consumer perspective. Probably the big thing there are two words. One is trust,
Right.
and the other is data. So the trust, the big T. Um, Lots of people have different feelings about Amazon. Are you going to trust them when your kid's sick? And that you're going to trust them to not only kind of intake you the right way, but also if they can't handle the problem, who are they going to refer you to?
Correct.
Now, their acquisition of One Medical is very interesting, and in contrast to Amazon Care, which they shuttered. Okay,
Mhm.
Amazon Care was much more of a tech-driven type of approach, where there wasn't a lot of trust to begin with consumers. Whereas One Medical, they already have 750,000 members, patients. They already have their own clinicians. The trust is already there, so they kind of bought trust. All right,
Right.
at least for 800,000. But for consumers generally, if you think about it, will the DNA and the trust of One Medical, as it was this standalone entity, be able to scale as Amazon tries to go from 700,000, 750,000 to like 8 million? How
Right.
much of that trust will be able to be scaled? I think is something that will be is, are they being responsive to you as a mom or as a dad? Are they referring you and or your child to the right other venue of care? Because Amazon, one that they don't have an emergency room, for example. They don't
Right.
have like surgical services.
Mhm.
You'll still have to enter that part of the health system, when that need arises.
So if I understand it, you sign up for Prime. It's about $9 a month for the primary owner of the Prime account, and then for family members, another six. And then what do I get? So I get this telemedicine. I get the access to their pharmacy business. What else comes as part of this package?
Yes. The one additional thing is that they do have one medical primary care clinics. So, for
Okay.
example, there's one just a couple of miles away from me. They're mainly in metro areas,
Hmm.
and then you'll be able to go visit those offices. Now, those offices, you have to be insured. So you still have to have, let's say, your Blue Cross Blue Shield insurance in order to get in-person care.
Interesting.
And what I think what they've done a good job of is on um, the website for the Amazon Prime One Medical offering. They do have a nice, easy to use search tool. In fact, I just used it this morning, and I found that indeed my uh, healthcare insurer is on that list.
Okay.
Um, but that is one limitation. However, is if your health insurer is not on that list, so it doesn't mean you can just get rid of your healthcare insurance. Not at all. If you want in-person care, you're still going to have health insurance.
So this is just sort of very primary type of stuff, right? I'm not feeling well, may need some antibiotics. I get a telemedicine doctor or I go to a clinic, and they just sort of almost stuff that like a nurse practitioner can handle. Is that how, would that sound right?
Generally, yes. I think where they have a real draw is 24 by 7
Sure.
virtual visit access. When you think of the Amazon brand, you do think of 24 by 7.
Yeah.
Um, so yeah, but exactly that. I think that's for those type of relatively mild situations. Heck, I'm going to try. Like I'm on the board of a competing health system here in
Mhm.
China, but I'm going to try this even just to do it research
Sure.
because for $9, there's a lot of there's a lot of things that you will just try out for $9 and it's cancelable every month, right?
Yeah.
So why not?
Why not? Especially if you don't have any type of coverage, right? Like
Yeah.
it's almost a rounding error. Um, Listen, as a business owner, just like you, all every year after year, I just see my healthcare go up. I see the delivery of care not getting that much better. I'm so happy. I don't know if Amazon has the right solution, but I'm so happy they're in it because it does need disruption, and we need to provide better care and lower that cost and improve the outcomes. We can get into a whole probably separate discussion, but Amazon tried it once before the healthcare industry, if I remember, with Warren Buffett and J.P. Morgan Chase to try to do. And then what happened? Like, why did that
Yeah.
fall apart?
They actually tried twice before and they
Okay,
both failed. What you're referring to is the Haven. It was called Haven, the joint partnership with Berkshire Hathaway as well as Chase and Amazon. Um, Without naming specific names, the leadership of that organization was not necessarily the right fit
hmm,
for what they were trying to do. Issue number one. In other words, you may have some big names there, but they weren't necessarily like operator type people.
sure,
Okay. Um, the second is that to try to get three giants like that to do anything together, much
yeah,
less the most difficult subject on earth, which is healthcare, going to be pretty challenging. Even if
yeah,
you have the meeting of the minds of the billionaires or whatever over some cocktails. It's like it's not
sure.
okay. It's not that healthcare is very complicated. So the second tried was Amazon Care. Now,
Mhm.
just to recall, so Amazon Care was essentially Amazon first for its own employees, created their own virtual health uh, um, telemedicine platform, as well as had in-person, clinics at their various geographic locations. Obviously, a lot of this was,
Sure.
pre-pandemic, right? Um, but what they found is when they tried to take that offering and sell it to employers, who are, primarily self-insured employers, what they ran into were a big problem with not having enough clinicians on their platform to meet the
Interesting.
diversity of needs across these big employers. And so the employers are sort of look at, okay, we can work with Amazon, but they're only solving part of the problem. And I already have this, albeit expensive, but existing comprehensive solution. All right. Which is essentially I've got, agreements, right, with someone to administer my self insured insurance plan. And then they have the whole provider or clinician network, right? So really, what am I getting? And then the other thing was that, I'm a big like, do I really want to trust Amazon? Like they're
Right.
eating my lunch they're killing my e-commerce business. Do I want to, now hire them to like
Right.
look after my employees, or maybe one day they will eat my lunch, right? So
Sure.
there's again, it comes back to like also a trust issue on that. But I think to Amazon's credit, they learned from that, and in fact, they were very public about some of the learnings that they got from shuttering Amazon Care and their own self-insured kind of employer offering. In going out and acquiring One Medical, they not only acquired providers and they and clinicians and the trust they had with those 750,000 customers, they also bought the fact that One Medical has 8,000 enterprise customers already.
Wow, I had no
Okay,
idea.
yeah.
That's amazing.
So I thought it was very, very interesting
So it's
move.
a smart
Again,
acquisition for them. I mean, that's a 3 billion. I think that's a rounding error for Amazon.
well, yeah, I guess so. But
Yeah, I mean, for
again,
you and I, we could buy
that,
the Bulls with that kind of money, but yeah,
yeah, right.
for
Well, the
Amazon,
Bulls right now maybe for 1/10 that amount, right?
yeah,
But
right. Tell
anyway,
me about it.
based on what they're doing. But again, the question is, will they be able to scale that 10x to
Yeah, right.
truly have a transformative sort of beyond niche impact on healthcare? That remains to be seen. And right now there's a big shortage of clinicians too. If I'm a clinician, do I want to go work for Amazon?
No, yeah, you're
It
right.
used to be I was like working for One Medical. By the way, the founder of One Medical is also Tom Lee, but his middle
Fascinating.
initial is different than mine. All right, but anyway,
I want to be
much more
friends with that
success.
guy.
Yeah, yeah, I know. He's much more successful and well known.
Yeah.
A little bit, a little bit. He's a memorable guy. I don't know. He'd be watching this, but I
Yes.
remember meeting you, Tom. You were a very friendly guy. You're just a little bit different from me, but there you go.
All right. So predictions, Amazon. Where do you think they take this business? If we fast forward and we look 10
Yeah.
years from now, where is Amazon in the healthcare world?
Well, assuming they can at least mostly scale that trust, all right, there is no doubt that with their own pharmacy business, um, and assuming I think it's a fair assumption to say it'll be increasingly integrated with One Medical.
Okay.
Just like Amazon, for example, Amazon Returns is very integrated with Whole Foods right now.
Mhm.
And speaking of which, the fact that they've got Whole Foods is could be very, very important down the line, because increasingly in healthcare and medicine, food is looked at as medicine as well. That like a physician will actually increasingly, you will see as you go to your doctor, will be prescribing things maybe even directly out of their medical record system, that I prescribe for you these foods. And by the way, with one click,
Yeah.
there's actually a company in Seattle that's doing this, that's founded by a friend of mine. With one click, the groceries are already waiting for you at your local grocery store. All
I mean,
right.
that's great. It's always
Yeah.
blown my mind why a doctor doesn't have a nutritionist on staff, and then he
It,
walks
it's
you through, an analysis of what you should be eating and not eating. And I mean, it's the
it's a
fuel you
big
put in your body.
it's a big trend. And 10 years from now, there's not only incentives coming from Medicare and Medicaid to help fund food purchases,
Wow.
healthy food purchases. What you're going to see generally when that happens, and some of the commercial insurance companies are already ahead of this, and certainly the self-funded employers, they're also starting to address these so-called social determinants of health. These things that are not within the walls of the clinic or the hospital that are affecting your health,
Right.
that if you could get ahead of it, whether it's diet or exercise. So think of the Silver Sneakers program out of Blue Cross Blue Shield that pays for a lot of seniors like gym memberships.
Yeah.
But they only get that if they prove that they've actually gone to the gym. Do they actually
Correct.
get that incentive?
Yeah. Listen, I'm down on the healthcare industry, just like probably most business owners. Give me something to be optimistic about in the next couple of years, because cost
Yeah.
is like we talked through all of it, right? Cost and the delivery of care, and I don't think it's even healthcare. I think it's sick care, in my opinion. But give me something to be optimistic about.
I'll give you two things. One is that there is a set of companies, most of which are smaller startup companies, that are starting to figure out that there are certain employers, for example, small and medium business owners, who, given that where they're located geographically and given the healthcare providers and clinics and hospitals that are around them, have an opportunity to do something called direct contracting,
Mhm.
meaning that you cut out the middle man of the traditional insurance company, and you essentially have the ability to become a self-insured employer, but in a much more efficient way that takes advantage of much lower pricing. So, for example, the cost of an MRI image could be 5 times less for an employer if they go through this direct contracting mechanism versus if they go through the traditional route. Okay, so I think
Interesting.
that could be a whole nother potential guest for your podcast here is, I didn't mention, I know someone, who's very passionate about this, actually a very proven person in healthcare as well.
Awesome.
I think the other thing to be optimistic about is serving more of the currently underserved patients through tools like AI. Okay. And I mean that in a very specific way initially, is that the generative AI. Okay. I think of the, GPT-4,
Yeah.
ChatGPT. And what's happening now, and now it's obviously there's that word trust, right? The trust issue. But what's happening is that technology is growing in capability exponentially. It's already starting to be used very effectively in certain areas of healthcare operations. So, for example, maybe that initial chatbot that you have interact with at your hospital or health system, now it can even be smarter and automated. You don't have to worry about someone getting tired on the other end and not, being, courteous to you. One final kind of interesting data point on this is there was recently a study that was published in a very famous medical journal, which compared side by side the chat streams, of GPT versus an actual human clinician. Remember that story of John Henry, of like he's like pulling, you have the locomotive versus him, and then ends up dropping dead. Okay.
Yeah.
Essentially the same thing happened. All right. Is that what they found was that not only was the information more accurate in the GPT generated chat to the patients, this was over like thousands of patients, but those patients also found that the machine was more empathetic.
Oh my gosh.
And sympathetic to them than the human doctor. Well, then you can say, well, human doctor's only got 5 seconds to talk and he's got
yeah.
Well, look, they factored that out for the same amount of time that was spent on average. It was the GPT was deemed, because it's obviously a blinded trial.
Right.
GPT was statistically, materially more empathetic than the human clinician.
That is amazing, man. Well, so you gave me some hope. So now I'm hopeful. Amigo, I can't let you leave today without asking you a question about basketball. What is your thoughts on the NBA midseason tournament?
I like to listen and observe to what my son Austin listens, and Dan, my son very well. Yeah. He looks more like a football player now.
Yeah, he's huge.
He's very huge. You see him. And he loves it.
He loves it.
Okay, it's not only that the fact that the basketball court, the floor looks different, because it
really
reminds
cool.
Him of like playing NBA 2K, and you've got like my career thing. You could design your own court. But I think the elevation of play, and I've seen this as well myself, is very clear, because $500,000 prize for some of those bench players is a significant increase to their base salary.
Yeah.
And the superstars, where for them it's pocket change, they want to help their teammates as well. And so I think you're seeing that in the results. And I wish I could make it to Vegas, this year, to go see the.
I definitely want to make it, man. And it
out there.
We'll go. We got to go to Summer League. We've talked about it 100
times. 5 times. You say that every time.
Maybe this is the year we finally do it. This is the year.
You got it. Well, like I got some. You look. If you go, like you will be doing tons of pictures for me, because I'm doing like sports video and stuff. Like I got some choice shots that would be your homework assignment. Okay. Yeah.
We'll definitely do it. And then the next time I have you on, we'll talk about the Bulls. But Amigo, thank you so much. Let's do this again soon.
Most definitely, my friend. Thanks a lot.
Everybody, be good.
This episode is brought to you by Buena Vista Creative, Miami's premier digital marketing agency. Visit buenavistacreative.com for more info on how Buena Vista can help your business increase revenue and create the brand and digital presence it deserves. Video and podcast production, web and app development, search engine and social media marketing, logo creation, outdoor, print, swag, and more. Visit buenavistacreative.com to learn more.